in the United Kingdom who struggle with gender dysphoria have been let down by the UK's health system. That is the conclusion of the long-awaited Cass report, which was commissioned in 2020 after a sharp rise in the number of children referred to the NHS or National Health System for so-called gender-affirming treatment. The much-anticipated report by Dr. Hilary Cass reviewing the UK's approach toward gender identity services for youth under 18 came out this week, and this is what she told the BBC.
What's unfortunately happened for these young people is that because of the toxicity of the debate, they've often been bypassed by local services who've been really nervous about seeing them. So rather than doing the things that they would do for other young people with depression or anxiety or perhaps undiagnosed autistic spectrum disorder, they've tended to pass them straight on to the GID service, and they then ended up at the back of a very long waiting list because GIDS wasn't really able to cope with the rising numbers and the complexity of their presentations.
So this new report by Dr. Hilary Cass comes in concert with a number of other restrictions that have been taking place across Europe in regards to how children with gender dysphoria are treated by the medical system. The Dutch model was really the first indication of this idea that we should just affirm kids in their gender. We should put them on puberty blockers, hormone therapy, whatever they need to supposedly help with their gender or body dysphoria. And they've pulled back on that because of a lack of evidence that any of these treatments they were providing children were helping them with their mental health outcomes. Now that has prompted a further review in other parts of Europe, including this review by the National Health Service, led by Dr. Hilary Cass. And I wonder what you make of this, Jess. She says in the report that she couldn't find any evidence that puberty blockers or hormones helped children's body dysmorphia. She says that the NHS should be treating these children holistically and talking about the underlying reasons for why they have issues with their gender identity. What did you take from her conclusions?
Yeah, I just don't see this report changing much. It read as something that was extremely opinionated, that negated a lot of the evidence that's out there. And I think, disproportionately focused on gender dysphoria and the treatments for it as, a field with a lack of evidence when there's any real new realization in the medical community that there is, a legitimate problem, right? For so many years, mental health issues were just written off as this person's crazy, they'll be institutionalized. They were absolutely treated without evidence-based medicine, but also without care for the patient themselves. And I think that's the difference here is that, there is far more care for children. And there's a lot more attention, certainly, on this issue in the news and in media, but it's not being weighed with the same criteria as other medical procedures or medical treatments. When we think about experimental cancer treatments, of course, we don't have long-term evidence for those, but we don't really question those. We say, okay, it's between, your doctor and the patient, and they're working on collecting the long-term evidence. For some reason, that same, deference isn't awarded to gender-affirming care. When we talk about people deciding to detransition, if they have transitioned, we treat it as if it's this horrible situation, rather than just acknowledging that 1 in 7 surgeries have a regret rate from the patient, self-reported. And so I do think that there is a bias. It reads a lot as opinion, and it just doesn't read as a medical report from Dr. Cass to me.
Yeah, so it is a little bit different in the National Health Service in Britain just because it is a government-run healthcare program, that they are a lot more restrictive about what treatments they approve or don't approve. They don't have as many experimental treatments like the type you're referencing, but I would say the fundamental difference between an experimental cancer treatment and what we're talking about here, which is what they refer to as gender-affirming care for youth, is that youth are not capable of consenting properly to these treatments, and especially their parents can't consent if they're not aware of the downsides and the potential drawbacks of going through this type of treatment. And that is what Dr. Cass's report finds, which is that the Tavistock Clinic in Britain and other gender identity services that were provided by the NHS were not properly informing patients of the risks of these treatments. And they also were not taking into account the fact that the vast majority of youth who struggle with gender dysphoria end up growing out of it when they get to adulthood. So instead of taking a wait and see approach and allowing children to make the decision when they were capable of doing it because their brains had fully developed, they could understand the weight and the consequence of what they were doing, they decided to go ahead and prescribe puberty blockers under the assumption that there would be basically no side effects, everything would be fully reversible. The child could get off their puberty blocker if they decided that they weren't actually trans, and everything would be fine. And what she finds from, again, this research is she finds that, one, there are actually long-term effects of being on puberty blockers, especially the longer that you're on them. And two, they had the substantive effect of basically locking kids into a transition where kids felt like they couldn't go back, they couldn't tell parents that they changed their mind, and they ended up going on to hormone therapy, sex changes, etc. And so it actually ended up making it very difficult for children to end up detransitioning until it was really too late. And the consequences of detransitioning should definitely not be, talked about as if they're no big deal. I mean, when we hear the testimony of these people, their bodies are basically ruined for the rest of their life. You can't go back when you get a double mastectomy, for example. You can't go back if you get a bottom surgery. You can't go back in a lot of cases if you're on hormone therapy because it ends up rendering you sterile. So you have this generation of children who were mistreated by the medical establishment and are now coming to terms with the fact that they're never going to procreate. A lot of them have lost complete sexual function. A lot of them are incapable of presenting as the biological sex that they were born as, that they wanted to be but are not capable of being. And so they're suffering still with this massive confusion about how exactly they're supposed to live in this body now that doesn't match the biological reality of who they are because they were sold a bill of goods from doctors. And I mean, I hear what you're saying about you think that it's opinionated, but she went through, I think there were 60 studies about gender care for people suffering from gender dysphoria, especially children, and she couldn't find a single study that abided by normal scientific standards.
Yeah, I think she clearly is making adjustments for normal scientific standards. There are a great many studies into puberty blockers that have been done, yes, in recent years, but they have been done. They're available in scientific journals around the country. This one study by Dr. Turbin, Dana King, Jeremy Carswell, and Alex Kuraglan, they show that of a sample of young people that were experiencing gender dysphoria and gender-related care was sought, there were 16.9% reported that they did want, puberty blockers. They did want to suppress that process, which would delay puberty for a period of time until they were very sure that they did want to pursue a transition. So it is an irreversible thing when your body goes through puberty, to go down this path of developing whether, feminine, womanly characteristics or male characteristics in a way that's really irreversible. And so if a child's uncertain about their gender, this is a way to delay that. And so of those who wanted these puberty blockers, of those who received them, they had lower odds of lifetime suicidal ideation than compared with those who wanted the puberty blockers and did not get them. So this assumption that there is no mental health effect of receiving gender-affirming care is just not proven in the scientific data. And to discount some studies but rely on others, I do believe is to intentionally pursue what I think is someone who clearly, has a bias. Whether are they transphobic, I'm not sure. Do they feel this way about all kinds of scientific research? Are they terrified of the newly approved NHS mRNA research that shows it can effectively treat some kinds of cancers and is effective in terms of immunotherapy? I'm not sure if this is a doctor who always wants this level of, analysis for every study. It doesn't seem that way. It seems that this is a bias against gender affirming care puberty blockers are an alternative to transitioning early to receive gender-affirming care that would have a child go through puberty in the direction of the gender they identify with that's not their gender assigned with birth. So puberty blockers are a way to delay that until the child is older and ready to make the decision. There are a ton of lifelong decisions parents make for children other than these that can result in lifetime unhappiness. And so I do think there's a taboo around gender-affirming care that is, affording it this level of scrutiny that's not present in other elective medical procedures.
I think there is a functional difference, though, between, one, the irreversible effects of going through puberty versus stopping puberty or delaying puberty, which is that one is a natural function of the body. The other is unnatural and ends up resulting in these side effects that do result in people not having normal, healthy functions of their secondary sex characteristics, which is hugely problematic. And in terms of parents making decisions on behalf of their kids, yes, they do make decisions on behalf of their kids. But in this case, they are relying on the child to tell them how they feel, which means the child is being involved in the decision when they're not capable of properly consenting. And in regards to Dr. Hillary Cass, I don't think there's any evidence that she's transphobic. She has been a pediatrician for a number of years. And then finally, before we have to go, I would just say on this turban study that you're referencing, there are a lot of issues with that particular study. People can check out James Lindsay's Substack to read about his breakdown of the data and a lot of the issues that were presented by turban. It's definitely not, it doesn't prove what it claims to prove in terms of the effectiveness of puberty blockers. And when we're talking about studies that are not scientific or don't follow normal scientific rules, there are basic fundamental principles that we would rely on or assume we should be relying on when determining whether or not a medicine is effective, and not least of which is making sure that the study is double-blind, which none of these studies that Dr. Cass reviewed were. So, that's number one.
Would you support a double-blind study? Would you support a double-blind randomized controlled trial for children receiving puberty blockers?
Well, that's what the NHS is actually doing now. So what Dr. Hillary Cass's review led to was the NHS saying that they're not going to prescribe puberty blockers outside of clinical settings. From my personal perspective, I would say that you shouldn't prescribe them to anyone because the potential for harm is too great, considering 85 to 90% of children end up growing out of their feelings of gender dysphoria. The negative effects are far over the potential positive effects of a child going on puberty blockers. But I'm not the doctor here. What Dr. Hillary Cass has suggested and what the NHS is doing is in fact limiting those to clinical research settings so that they can get additional data on the prescription of puberty blockers to treat gender dysphoria.
Yeah. Do you think that 80% figures probably discounting the external factors of societal pressures to stick with the gender you were born with and the kind of stigma around transitioning?
No, because I think that you would probably see more people go back into adulthood, more people transitioning later in adulthood if that were the case, when they were more sure of who they were. But these people are staying their biological sex for the rest of their life. And I also think that this is the most, actually the least critical time for someone to be transgender. In fact, in Abigail Schreier's book, she talks about how there's a trend of young girls in particular who are transitioning because of a social contagion effect, because they end up getting lauded by their peers if they decide to go through a transition or say that they're queer or non-binary, and they end up getting a lot of social status out of it. So I actually think it's the opposite. I actually think we're seeing more children say that they're trans than we would have 10, 20 years ago because they're being celebrated for it, not because and they grow out of it because they don't really believe it. They're just doing it so that they can get praise from their peers. So actually, I think the desistance rate is more due to the fact that young people are coming out for social contagion reasons as opposed to really struggling with gender dysphoria.
And would you credit the high suicide rate among the transgender community to be unrelated to their gender dysphoria?
I'm sorry, I didn't catch what you said.
Would you credit the high suicide rate among the transgender community to be credited to something other than gender dysphoria? Just
Yes,
unrelated?
I would.
Related?
Well, gender dysphoria comes out of other underlying mental health conditions. Most people don't start with gender dysphoria. It's usually due to other factors like autism, like bipolar disorder, depression, anxiety. And so especially with these young people, when we're looking at Dr. Hillary Cass's review, she says one of the main problems is that people are not getting proper psychotherapy to address these underlying reasons why people have discongruence with their body, and we're just putting them on puberty blockers. I mean, a lot of trans people are people who were molested as children, and young girls will try to present as a boy because they don't want to get molested again. So yeah, absolutely. I do think that there is a difference between, or there are underlying reasons why someone has gender dysphoria, and the suicide rates are higher because they do have these untreated underlying mental conditions. That's why it has been some research done into the rates of depression and anxiety, both pre and post transition, and they find that they're either consistent with or higher post transition. And I know we're going to keep debating this. We're way over time, so I apologize, but we're going to have to leave it there. We'll be back with more Rising after this.